Welcome everyone to today's webinar. We're excited to have you here. I'm going to go ahead and just jump in. As many of you know, healthcare has changed. The pandemic has forced a reinvention of the healthcare customer experience, and increased consumerism overall has expanded choice and initiated a digital-first mentality across the industry. The digital front door has become the primary access point for people to find healthcare, understand options, and provide feedback on their experience. This shift in consumer experience and expectations requires healthcare organizations to understand how to successfully operate and win in the new feedback economy. This is the focus of our webinar today, and I'm excited to introduce our incredible speakers. First up is Annie Harmon. She leads healthcare and life sciences strategy at Reputation, the world's leading consumer experience and reputation management technology. And then Dr. Esteban Lopez is the leader of healthcare and life sciences at Google Cloud, which empowers healthcare and life sciences leaders to make decisions from disjointed healthcare data. I'm pleased to turn it over now to Dr. Lopez to get us started.
Thanks so much. Really excited to be here. Let's go ahead and move on to our next slide. I want to talk a little bit about the changing nature of healthcare. Healthcare is changing rapidly, and consumer focus has become a priority for both payers and providers. In fact, in 2021 survey of healthcare executives by Kaufman Hall, it found that 73% of healthcare executives believe their digital offerings lag behind non-healthcare industries. However, only 7% of healthcare organizations have dedicated focus and resources to build a consumer-centric infrastructure in order to deliver on the positive consumer experience. So obviously, we have a huge disconnect between our aspirations and our reality. Annie, I'll turn it over to you.
Thank you. And, you know, one of the biggest drivers of this consumer shift is that we now live in a feedback economy, and anyone can research anything before making a purchase decision. Third-party ratings and reviews influence everything from the stores you're shopping, whether you're shopping on Amazon or a new restaurant in your neighborhood. This expectation has extended to healthcare. And ratings and reviews are now the most important decision-making factor for patients after insurance and location. The vast majority of healthcare consumers actually trust online reviews, and they want to choose a doctor who is rated 4 stars or higher on Google. But for our 2022 Healthcare Consumer Experience Trends Report, we went ahead and we partnered with YouGov to survey over 1,000 healthcare consumers, and we learned a lot of compelling findings about this consumer journey. We learned how healthcare is embracing a feedback economy where ratings and reviews drive business performance and growth. And I'll just look at some of these stats. You've got 72% of US adults reading online patient reviews when they're considering the decision of a facility or a physician. You've got 55% of millennials having selected one care provider over another just based on online reviews. And half of these people are reading 10 or more reviews. Many are reading 20 or more reviews. And 72% of them want the provider that they choose to be 4 stars or higher for them to be selected. So clearly, we're entering this new era of healthcare that is driven by the same level of consumer choice as a retail experience would be. Now, in healthcare, we've been talking a lot about the digital front door for years. And this is why Google is such an important part of that consumer experience. So number one, Google is the most popular source for searching a physician or hospital. It's even more popular than your physician or hospital or health insurance website. These are going to be more popular than your WebMD or HealthGrade sites or even social media. Google is also the #1 review site used by healthcare consumers. Now, 81% of healthcare searches that are happening on Google today are related to symptoms. And so what Google has done is they've started serving up healthcare related data right there in the immediate results. For example, if I search, what does a hernia feel like? I'm going to get these blue buttons across the top of my mobile experience. And that consumer behavior is now that I am intercepted by Google before I even make it to the website where I would learn more about a hernia. I can see it all right there in the Google experience. In fact, 65% of organic searches result in a conversion right here in the Google experience without ever making it to your website. Now, if you look at this consumer journey in search results, Google's going to favor its own content first and prioritize content that includes patient experience feedback. Reviews are the fastest growing factor in Google's search algorithm because this is very important to consumers. And look at all of these actions that a consumer can take. They used to have to go to your website. Now they can look at photos, read reviews, look at what services you provide. They can click to call. They can schedule an appointment. They can check their insurance coverage. They might even just click to start a virtual visit right within the Google business profile. So this is the starting point for that consumer journey. But how can we make that consumer journey better and more frictionless? Well, it all starts with getting your arms around your data. And for that, I'm going to turn it back over to Dr. Lopez to share more.
Well, Annie, I couldn't agree more with you. As you know, I'm a practicing physician, and so I have two clinical practices, and I'm very concerned about my Google reviews and my 5-star rating. So it's very important. I knew that my patients are definitely looking at that, especially since we're a walk-in urgent care. But it's a lot about data and signals. So you were mentioning data, and so data is useful if it's giving you signals that can be used to make the experience of healthcare more delightful. Leading healthcare organizations are using data to improve experience and outcome. And so looking at those signals and following where those signals take you, give you actionable results. Let's move on to the next slide. You know, the big challenge that we have is that we have a lot of data, and a lot of data that's unstructured and unorganized, but really poor insights. And that's where Google comes into the picture to be able to create some organization around that data, taking unstructured data and putting structure into it, especially things like the reviews, or even my note that I may write, and having information abstracted from that to be able to really better understand my patients, or to understand members. I used to work for Blue Cross Blue Shield, so data there. I used to say that the value of Blue Cross was not the ability to adjudicate claims or create networks. It was the data that they had with regards to members and providers, and being able to unlock the value of that data through things like artificial intelligence and machine learning. That takes me to the next slide. You may not be able to gain actionable insights until you start bringing data sources together. It's important for healthcare to manage each and every stage of the data life cycle, from running operational transactions to managing analytical applications across data warehouses and data lakes, to rich data-driven consumer experiences that break down the silos. We have so many silos in healthcare. Artificial intelligence is a core component of healthcare's digital transformation, not only for improved insights, but also to automate critical business processes using data as the core. For example, to understand the voice of the customer, you need to look at multiple sources of data. Unfortunately, in healthcare organizations, this data is often managed in silos. In fact, 68% of organizations report that they're still unable to realize tangible and measurable value from data. And the answer lies not just in collecting more data or creating more noise, but gaining actionable insights. So using artificial intelligence to analyze unstructured data, both clinical and non-clinical use cases. An example, to deliver a great consumer experience to patients and members, you need to monitor your performance at the brand, service, and even an individual doctor or location level. You have to look at the themes like wait times, bedside manner, and quality. And while you may start by benchmarking your own performance, you also want to see how you compare to your competitors. One benefit of analyzing feedback data is that so much of it is available publicly. You can get an apples to apples comparison to your competition by listening to the feedback patients and members post on social media and reviews about their experiences. This kind of artificial intelligence analysis at scale is a powerful complement to traditional research based benchmarking or focus groups. And analyzing this kind of data is impossible without using intelligent analytic solutions with natural language processing to uncover themes. And remember, your customer for a hospital organization is not just the patient, but it's also the doctors and the nurses. So being able to understand all of your customers, if you're a healthcare organization like a hospital organization, is going to be essential to deliver a quality experience not just to the patient, but to all the frontline caregivers. Once you've uncovered the themes in your data, you can start to prioritize your operational improvements. For example, if there's a problem with wait times in the ER because too many people are showing up with minor symptoms that would be better served at a walk-in urgent care, you can then understand that and direct them to the urgent care. Does the call center have an issue with lengthy wait times for members trying to understand their in-network benefits? How do we automate that? How do we use artificial intelligence? By listening to what your customers or consumers are saying, you unlock the value of data that is already available. When you gain insights, not just information, you can prioritize operational improvements based on what signals are rising to the top. And that's really what the data is for, is those signals that end up rising to the top. So there's a risk of inaction. If healthcare providers and payers continue to operate with disconnected data systems, you'll continue to see patient attrition. They vote with their feet. With the increase in consumer choice, there's a decrease in loyalty. So if your customers are feeling the friction of a disconnected experience, they won't be loyal. Revenue loss. We heard how important feedback is to patients when selecting a care provider. They will select another provider if they don't see good feedback from others like them. And then increased competition. Let's face it, there are plenty of retailers ready to disrupt healthcare. They already have a robust data management system and a deep understanding of customer experience. Healthcare providers and payers need to deliver the experience patients and members have come to expect from other aspects of their lives, such as shopping in retail or social media. And fines. If that wasn't enough, there's also legal implications to consider. The recent No Surprises Act is just the beginning when it comes to regulation that will make healthcare more accessible and enable consumer choice. There will be fines for poorly managed data that results in out-of-network surprise billing. To mitigate these risks, you need to deliver an amazing experience to consumers across all channels. And he's going to talk more about this as well.
All right, thank you. So, now that you're all a little bit scared because we've talked about what can happen and what's at risk, let's talk about where you can start to build a successful CX program. It's all about eliminating friction, filling in the gaps, and then reimagining things, whether it's a consumer seeking care, a patient who's actively receiving care, a provider who is delivering that care, or a member who's trying to navigate their own care.
And for the dumb docs out there who don't know what CX, it's consumer experience.
And, with all of these separate consumer experiences managed by different business functions, it's difficult to offer a seamless consistent experience of the brand. And every touch point might be different, whether you are booking an appointment or trying to get a referral or calling about a bill or a benefit that you thought was covered and you're finding out it wasn't. The most successful healthcare organizations are starting to open up these former silos and really start to come together around this idea of the consumer being at the center and this single experience. And they're starting to examine each of the experiences that a consumer might have to ensure that we are delivering on the brand promise. So I shared a typical consumer search journey that starts, from a symptom search all the way to a conversion, all of that within the Google experience. But increasingly, consumers expect an omnichannel experience. Now, what that means is they want to be able to access what they need whenever and wherever they are. After all, they can get this experience in other areas of their lives. So if I want some pizza, let's say, I can pick up the phone and dial. I can use a mobile ordering app, or I can just show up at the restaurant. Regardless of how I initiate that experience, my pizza is still going to taste the same. The key is that the data about me, the customer, needs to be shared across those channels to ensure that I end up with the toppings I want. Now, we all know this is a very overly simplified example, and healthcare is far more complex than ordering a pizza. But the point is that consumers want their experiences everywhere to be just as seamless. So let's walk through an example of how today's consumer is expecting to access healthcare via any channel. One of the first things that they're going to do is to try to find a doctor nearby and look at feedback on that doctor, whether it's in the search engine or looking at reviews that show up in social or looking at peer review sites. Once they decide that this is the right care for them, they will schedule an appointment. So they could do that through text, email, phone, or a direct message with the practice. We have to enable this to happen across all of those channels. So once they have done that, let's say they've booked an appointment over the phone, but later they realize they need to reschedule. So can they send the office a message through Facebook Messenger? Can they go to Google and open up a chat? What consumers expect is that they can. They want that customer service for healthcare that is on par with what they can get in retail brands. So let's say that they do want all of this. The easier that you can make it as a brand to move that person through channels seamlessly, the better experience they're going to have, and the more likely you're going to retain them within your network of care. Whether it's a member who is part of your payer network, or maybe it's a patient who is staying within that medical group, the last thing you want is for some kind of friction to lead them to choose another avenue of care. So every visit should usually end with a patient receiving some kind of a request, hopefully a text request for a survey or a review. And this is a very important step for healthcare brands to take, because requesting a review will activate that silent majority of your customers to post something positive that maybe they wouldn't have shared if they hadn't been asked. And this is a common concern we hear from a lot of healthcare clients is, how do we start this when we're looking at our reviews today and we have a 2-star average? I don't trust that if I ask everybody for feedback, it's not going to go down. Well, in every case that we have ever deployed a programmatic feedback requesting program for healthcare, that sentiment goes up. And the reason is, like I said, you are activating a silent majority that is having a good experience with your brand. In fact, among all of our clients that have implemented review requesting via SMS, text, or email, we see an average of 507% increase in the volume of online reviews and a 30% improvement in positive sentiment. And this is because you're getting a much broader data set. You're getting a more statistically significant view of that experience. Now, speaking of getting a better holistic view of the experience, this is where there's something really important to think about. The only way for you to get a complete picture of every stage of your customer journey is by combining both solicited feedback like surveys and unsolicited feedback like social media and reviews, pulling it all together to truly understand your customers and analyze that feedback at scale. So, for example, how do you possibly know what your patients might be feeling or doing about your brand or your providers or your services if they're just anonymously checking review sites or visiting third-party websites? Often these same people are talking about their experiences along the way. What are they happy with? What do they find disappointing? There's a wealth of feedback to be understood simply by listening to what is being said online about the experiences with your brand. And that's whether you ask them or not. And as you can see from this graphic, traditionally, we have waited until the end of an experience to solicit that feedback. Patient experience surveys would usually go out after they have completed their care. But what is also happening is they are sharing about this experience across that entire journey. How easy it was to book an appointment. How long did they wait in the lobby? How friendly was the front desk staff? You have to look at what is being said about you across that entire journey and using that unsolicited and unstructured feedback. So we mentioned before that building a successful consumer experience program is about eliminating friction, filling in the gaps, and then finally reimagining that experience for consumers and providers and members. But this can seem really daunting to that 93% majority of leaders who don't feel equipped to deliver that experience yet. So this is, the way that we look at things from a CX maturity standpoint. You don't have to do this all at once. Most organizations are now approaching digital transformation with a roadmap. Think about it, the same way you would about any of your technology products. We think about consumer experience technology the same way. It all starts with managing your data. You need a way to actively obtain, listen, and understand multiple sources of feedback and extend this across your customer lifecycle. But once you've managed your data, you also need to get new actionable feedback after you've already established a baseline. So using artificial intelligence, you can start to analyze raw feedback data. That's called natural language processing. You can understand the themes that are coming up and then use that to take meaningful action in the future. But what's also really important is not just the overall themes that you improve, but real-time resolution to customer issues. So you need automation and workflows to close that loop with the customer in the most efficient and scalable way. And I'll just mention one thing really quickly. Reputation is the only company that brings together all of this experience management into one unified platform. So you can accomplish all of what we've discussed today in one place. The other thing I like about this visual is that it shows where most healthcare brands are. So, it can be daunting sometimes to look at, well, if we're healthcare and we have to be a consumer-friendly industry, but retail has already been doing it for years and they don't face the same kind of regulation and data challenges that we do, how can we possibly catch up? Well, you're not alone. Most healthcare brands have not reached the same level of maturity as consumer brands yet. You don't have to tackle everything at once. You just have to start with managing your data and listening to feedback. The good news is, no matter where you are in terms of maturity right now, you can start to take some important steps to build out a successful program. So let's start with manage. Think about this as crawl, walk, run. Service recovery is your table stakes. It's the minimum you can do. When a patient shares a bad experience on Twitter or in a Google review, you need to route that to the appropriate team for resolution. It's all about real-time customer service. Now, in the past, we looked at social media as a thing that marketing would manage because they were the ones posting content and putting messages out there and managing the community. But what has happened is other brands have started using social media and reviews as a real-time customer service channel. And so healthcare now has to start doing the same. If your call center isn't involved in responding to social media, if your patient advocacy team is not aware of what is being said about your experiences online, these are things that need to come together. You have to start managing that data at scale and being able to respond to things. The next step is that you identify patterns and trends in that experience and start to make operational changes that are going to eliminate the dissatisfaction. So look at this as fixing the bigger problems that exist. You're creating resolutions to eliminate dissatisfaction before it occurs another time. This is where you look at key themes and launch programs that are going to operationalize that improvement. The third step in the mature CX program, where you really start to grow, is when you bring all of your feedback across every channel into one single place and you start to analyze the voice of the customer. You can really determine what is a great experience, define that, and then reinvent that. Reinvent the experience to deliver on a brand promise that maybe you were unable to live up to in the past. And this is what consumer experience improvement is all about. It's not just responding to what's not working. It's creating new experiences that will, as Dr. Lopez said, delight your patients.
What I really like, Annie, is the fact of taking the entire journey end to end and figuring out where in that journey there may be potential pitfalls, because maybe registration was amazing, but x-ray was less than amazing, or being on the ward was great, but maybe the discharge process was again very difficult. And so understanding where those amazing centers of excellence within your organization from a customer service perspective are working, and then using those examples to build on the others, right? Why is that working so well? Why is the patient so satisfied with that experience? And then being able to take that across your organization. It reminds me of a recent hotel stay. The valet front was amazing experience. Like the bellman and valet experience was great, but the rest of the experience at the hotel wasn't. I'm like, they should really be training the rest of the hotel, which was a 5-star hotel, on how to be better, because they really were super well organized. We can take that in healthcare and replicate it as well, because customer experience also leads to better healthcare outcomes. They engage with you better from a doctor-patient relationship, and that's so important. You want them to follow up. You want them to feel comfortable. You want them to be able to follow the plan of care and to have a delightful experience in whatever healthcare setting they're in.
Yeah, it's a great point, and it reminds me of the most recent 2022 healthcare consumer survey and reputation reports that we put out this spring. The largest driver of positive feedback across the nation at large health systems from consumers was doctors and nurses. They love their doctors and nurses. They're getting a great experience with them. And not surprisingly, the largest negative sentiment drivers were things like wait times and administration and billing and parking. Now, none of this is new, but what it shows us is that we can take what's positive about that caregiver experience, and if we can bottle that and kind of replicate it elsewhere in the experience, we can make it better. And the difference is, is there's something personalized about that one-on-one caregiver interaction that we can then take and make it part of the check-in experience, or make it part of the scheduling experience or the parking experience. Looking at ways to reinvent that. And, it also never hurts to take a few cues from the hospitality industry.
Absolutely. Well, as I like to say, reputation is everything in healthcare. My reputation as a physician or my practice is really what I stand on. So reputation as a company is the only experience management technology company in the Google Cloud marketplace. I'm really proud of that relationship that we have. Obviously, the slide speaks for itself in terms of the breadth and depth of what reputation is doing across the ecosystem. Google Cloud marketplace partner, the featured Google My Business partner, as well as Google Search, Google Reviews, Google Shopping, and Google Maps, and then a premium Google partner for search innovation and display innovation. So we're really, really thrilled about the relationship that we have with reputation. And I think the healthcare industry would benefit from both Google Cloud and reputation as partners together to be able to take them to the next level in terms of customer service, but not just customer service for the sake of customer service for the sake of better clinical outcomes.
That's great. Thank you, Dr. Lopez and Annie. Appreciate that. We definitely highly value our extensive partnership with Google as well, and appreciate the opportunity to co-present today. We've had quite a few questions come into the Q&A, and so I want to move into that time and just share with you some of the questions, and maybe you guys can help answer these. So the first question that we have is, how do you manage keeping data points like address, contact number, and other parameters, like whether a provider is accepting new patients, up to date?
I can tackle that one. I'll say I've been in your shoes. I've lived that experience, not only when I was on the provider side, working for a large national health system, but also now that I am on the technology side, I see it with all of my clients. This is a common issue, these data silos. So what I would recommend is start by bringing all of the owners of those data points together. And, maybe marketing owns the photos and bios, and maybe the credentialing team owns the credentialing data, and maybe another team owns the scheduling, whether they're accepting new patients or not, and determine where is there an opportunity to say, okay, you are now the owner and governor of that data point, and that this is what you own, and this is how we're going to manage it and govern it as a group. Because until you bring each of those owners together, you're going to be over here owning part of those data points and unable to have an impact on the overall holistic. And, you can partner with a technology partner that can start to do some of that mapping for you. Like, for example, another plug for reputation here, we have a directory product that a lot of our healthcare clients use to plug in, this data point from credentialing, and this data point comes from marketing, and this data point comes from legal. And each of those gets pulled in from a different source that we know the source of that data point is the source of truth. Whereas if we find it somewhere else, it might not be accurate. So we can pull all of that and into one single directory that becomes the source of truth that feeds all those external places. So like your website, like Google My Business, like your social media sites. And it's a good way of, not trying to boil the ocean. You're not going to get all of those data points into a single source of truth. It's just going to be too challenging at first, but work on it in stages.
Great, thanks. Okay, so the next one we have here, one of our viewers mentions they have two problems. One is their regulatory department is concerned that they don't have consent from patients to ask them for reviews. And two is that employed physicians think it's not a great idea to request reviews because they push back adding their review to their profiles, and they don't like it when someone leaves a bad review. They want to then delete any bad reviews. How do you handle these things?
I could start, especially with the consent aspect. So Google Cloud has a consent API that allows you to enable your customers, be it patients or members, to provide consent for the purposes that we're talking about here. And I think Annie talked about it from a physician perspective, is that if you're not soliciting reviews from all of your patients, the likelihood is the patients that are having the bad experience are going to be the ones that leave the reviews. If you solicit from all your patients, then that silent majority of people that are satisfied are going to then start leaving reviews as well. Now, obviously, if that silent majority is dissatisfied, then you have a problem potentially either with that practice or that physician. Annie, I'll let you take it from there.
I think that's a perfect synopsis. The only thing I would add is that, once you've requested a lot of feedback and you get, a nice, large, statistically significant data set, it's actually a good thing to have a few negative reviews sprinkled in there, because it just shows that it is authentic. It is real. This is an accurate assessment. Every human's going to have a different experience. And, someone likened it recently to when you go on Amazon and you are looking at, a new product, and they have, 500 5-star reviews and 0 1-star reviews. That is suspect. That tells you.
I think you meant Google Shopping there, Annie, but well, I'll let it slide.
Yeah, well, because the problem probably doesn't exist on Google Shopping. But it's this idea that, some real is good, even if that real is negative, and then respond to those. That's the piece that everyone overlooks, is if I'm taking the time to share something that bothered me, that brand should take the time to respond to me. And not only that, if the response isn't intended for me, it's intended for everybody else who comes after that patient, who will see that and see that, oh, well, they did try to solve that person's issue. And if it's truly an issue where the person wants it resolved, it will work out. If it's an issue where they're just trolling, or they're just, out to, slam you, then, that shows that will reveal itself too, because, people will see that in the interaction. So it's really important from an engagement standpoint to also respond to all of those reviews.
And today's consumers are very, very savvy, especially millennials and Gen Zs. I mean, they see trends, right? And so if the majority are positive reviews and there's a few outliers that are negative, they understand that as an outlier. And so they prefer to see the overall trend.
And there was one more part of that question that I'll just, without bringing legal onto the call and extending this for several hours, I will say I'm not an attorney, but I have worked with many, many of them. And, the concern around consent is valid. But when it comes to your notice of privacy practices that, if take a look at it on your own website, it's the thing that we all have to at least acknowledge that we've received, even if we don't read the fine print as a patient. But there is a section in there that refers to healthcare operations. And within healthcare operations, basically that consent should allow for the communication with the patient, using their information to communicate to them, to ask for feedback about the quality of your services. And that is covered. That is allowed under HIPAA. So, that if that's something that you wanted to dig into deeper, we have a ton of legal expertise in this area, because a lot of our clients who have not done this before often have that question.
Annie, I see a question with regards to Google My Business listings and insurance. It was directed to me, but I think you're probably a little bit more expert on Google My Business than I am. So they're too cumbersome to manage, and just they end up removing them because even their insurance team doesn't know all the individual plans they accept. So it's literally not possible to have an accurate list. What's your opinion about that?
Yeah, this is a tough challenge, and this is going to be I would say it's similar to the price transparency conversation that we started having a few years ago, where it's like, well, wait a second, how can we possibly get our arms around all of these prices and put it in a way that consumers understand? It's just too complicated. But here we are. We've, for the most part, figured it out. And I look at things like insurance as another one of those transparency data points that is going to be so critical in the future. That again, with surprise billing being an issue, with consumers demanding more, we are just going to have to start managing those insurances. And Google has already started to draw automatically from publicly available data sources. So if there is a network that has this listed, or Medicare is showing up now, and they're drawing from that data source, and so we can only expect that there will be more of this. And while it's tempting to just go in there and kind of remove them, or try to add notes that say, call us for insurance, that's not going to be sustainable in the future. And we're moving toward more transparency. So those data points are going to have to live somewhere. And in my experience, it has been that you follow the money. So wherever the source of truth is internally, that determines how your providers get paid, or what those reimbursements are. They're having to keep that updated because that's how they get paid. So that is a great source to start having that conversation around, what is the source of truth for these insurances accepted? And again, to go back to the first question, have one owner of that governs those insurances accepted, so that they can feed that in through an API to Google. And I will also mention, again, plug for Reputation. Reputation is the only company that is connected directly to the Google Insurances API. So you can manage all of that automatically through a data feed in that platform, and you don't then have to log into each individual Google profile and select through a list of 4,000 insurances.
And from a Google Cloud perspective, the data is only good as the data where it comes from. So if that data is siloed in different places, we can help solve for that by harmonizing that data, and then being able to surface it through something like either that API that you're referencing into Google My Business, but also through contact center artificial intelligence that can be omnichannel. So to your point earlier, it can be through social media, it can be telephony, it can be mobile based. It can be a web-based. So through a virtual agent that then says, you can ask, do you take Blue Cross Blue Shield HMO, right? And then it answers that question for you. Or do you take, Molina Medicaid or something like that? And so, because there's so many different individual brands, even within one insurance company or products. And so we have the capability to use contact center artificial intelligence that can lead someone from social media to the digital asset of the organization.
So another question that came through is, how do you recommend breaking down the feedback silos in order to work toward a more cohesive voice of the customer? So, you have all of this feedback coming in from different departments, different sources, and you might have something being said in social media that is not showing up in your caps, or maybe the call center is doing a survey, but it's just about that call center experience, and the appointment scheduling is a different survey. So you need to start pulling each of these sources into one single platform. And at Reputation, we call this feedback anywhere. It's this idea that you can take unstructured feedback, so just open text, open comments, and analyze it all together. It doesn't matter what that source is, but you can run natural language processing on it and pick up on the themes. So the first step is identifying, do an audit of all of those different sources, where that feedback is going, and then pull the comments into a single AI to analyze all of that data and spit out the key themes that are going to help you to understand, and prioritize your improvements. So it doesn't appear that we have any other questions. I want to ask Dr. Lopez, anything else you'd like to add before we wrap up today?
Well, there are four pillars of what I see the future of healthcare. Pillar number one is digitalization. So digitizing the data and creating structure around that data. Two is virtual care. Right now, we're calling it telehealth or virtual care. In 10 years, we're not going to refer to it as virtual care or telehealth. It's just going to be healthcare. And no one's going to care if you're having it on your phone, on your computer, live in person, or a store and forward manner. Three is going to be artificial intelligence and machine learning. And we talked a little bit about that today. And that's going to be more and more a part of healthcare for different reasons, allowing the practitioner to practice at the highest level of their licensure and training and taking them away from administrative tasks. But also, we're going to have a deficit of doctors. We have a deficit of doctors and nurses, and we're going to have an even larger deficit by 2030. So we need doctors and nurses taking care of more patients with less resources. So AI and ML is going to be a big part of that. And fourth is going to be interoperability. Right now, we have data silos all over the place. If you've gone to Minute Clinic, your data is there. If you've gone to your doctor, your data is there. If you've gone to a different doctor in a different healthcare system, your data is there. The patient doesn't necessarily have access to their own data and having the ability to share their data. That data needs to be interoperable, so we break down the healthcare silos and create a longitudinal patient journey. And all of that is going to be designed to take better care of patients. And I can't talk about patient care if I'm not mentioning things like social determinants of health and health equity, which is going to be a big part of addressing the cost of care in the near future. So really excited about where we're going from a healthcare perspective in terms of digital transformation. We're going to need digital transformation as part of the new frontier of healthcare. And part of digital transformation is really understanding the patient and the patient journey. And so that's why Reputation is such an important partner. And I can't emphasize enough that not just the patient, the customer, which includes the physician journey and the nurse's journey as well. We want feedback from them to make their experience better, because at the end of the day, that positively affects the patient.
Well, I feel like I can't say it any better than how you've just summarized it. I want to thank everyone for joining us today. And if you'd like more information about Reputation or Google Cloud, you know where to find us, reputation.com, or you can Google it. You can find what you need, and we'd love to stay in touch with you. So please reach out if you have further questions. And thanks for joining us today. Thank you, Dr. Lopez.
Thanks, everyone. Appreciate it.